Hey everybody, my name is Kaylee and I create videos on the Next Generation NCLEX, helping you guys prepare for the new questions that'll be on it. So I'm really excited today. I'll be sharing a case study with you guys and walking through the questions, giving you time to answer them as well, and then giving you tips on how to answer these questions on the Next Generation NCLEX. So super excited for this one. Stay tuned for the whole thing for a lot of good tips. Alrighty, so one thing I do want to note is the book I'm using for reference is called Developing Clinical Judgment for Professional Nursing and Next Generation NCLEX, NCLEX RN examination. So yeah, this is the book I'm using for reference to develop some of the case studies and everything like that. Alrighty, so our scenario is we have an 89-year-old female is admitted to the telemetry unit with a diagnosis of heart failure exacerbation. She reports a medical history of osteoarthritis, chronic lymphocytic leukemia, and coronary artery disease, including a myocardial infarction and coronary artery bypass surgery 22 years ago. She is alert and her daughter is at the bedside. To continue just at the end there, the nurse's initial assessment findings are as followed. So, highlight the assessment findings that require follow-up by the nurse. I'll give you guys a couple seconds to look through this. I encourage you to choose what you would select right now. You know, take it as if you're taking this question, and then we'll kind of talk through the answers. Please pause the video if you'd like more time. Otherwise, we'll go on to the next question and then we'll review all the answers at the end here and see how you did. Alrighty, so the next question here is indicate which nursing action listed in the far left column is appropriate for each potential heart failure complication. Note that not all actions will be used. So you can so for example, for acute pulmonary edema, what kind of nursing action would you do? You can read through the nursing actions and select one of the 10 and write the number, and then do that for each of these potential heart failure complications. Alrighty, so I'll give you guys a little bit of time to answer this question. Please pause the video if you'd like more time. Alrighty, so the third question. The provider has prescribed furosemide IV. What pharmacy class is furosemide? Alrighty, I'll give you a couple seconds to answer this. Please pause the video if you'd like more time. Alrighty, so an update. I'll read it again, just so we get an understanding. An 89-year-old female is admitted to the telemetry unit with a diagnosis of heart failure exacerbation. She reports a medical history of osteoarthritis, chronic lymphocytic leukemia, and coronary artery disease, including a myocardial infarction and coronary artery bypass surgery 22 years ago. The client is scheduled to be discharged today and will move in with her daughter until she feels well enough to go home alone. So, based on that, which of the following discharge instructions will the nurse provide the client and her daughter? Select all that apply. So, I'll let you guys read through the answers and give you a couple seconds to answer the question. on here. Pause the video if you want another minute. Alrighty, so now we'll go on to the correct answers. And yeah. Alrighty, so for question 1, we're highlighting the assessment findings that require follow-up by the nurse. So the ones that require follow-up, she's oriented to a person to self only. She has sinus tachycardia, respirations are 26, oxygen saturation 90%, breathing labored, use of accessory muscles, and productive cough with pink frothy sputum. So if you look at these, when you kind of answer these questions, the first thing I kind of want you guys to be thinking of is what is abnormal in general. So what are your abnormal assessment findings? Well, a person who's not alert and oriented times 4, anything other than alert and oriented times 4 is abnormal, so that is automatically. Someone with clear speech, that's normal, that's good, right? What we want to see. Follow simple commands, that's also fine. They kind of try to trick you in a way, like follow simple. Oh, is that meaning she can't follow complex? Doesn't really matter. It's saying she follows commands. She's not following commands where she's like confused and things like that. So following commands, that's good. Has sinus tachycardia. It's not normal sinus rhythm, right? It's not 60 to 100. It's abnormal, so that would be an indication. Respirations are 26. Well, our normal vital signs are 16 to 20 for respirations, so that's a little bit high, so that's abnormal. Oxygen saturation is 90% on room air. On the NCLEX, anything lower than 92% on room air is considered low, so even though 90 is like, oh, it's 90, on the NCLEX world, anything below 92, so that's abnormal. Breathing labored and use of accessory muscles. So if it was breathing labored only, I want you guys to know labored means that it's like not regular, that they're like taking a breath and then a breath, and it's like irregular, it looks struggling, or looks like they're struggling, things like that. And here it says they're using accessory muscles, so their breathing is not even regular, regular, so that is abnormal. And then she has a productive cough with pink frothy sputum, so that is also abnormal for her. If we keep going just with abnormal and normal, crepitus and bilateral knee joints, is that normal? No. Enlarged bony nodes on hands, is that normal? No. Same with a white blood count of 12,000, is that normal? You know, you're 4 to 10? No. But why aren't those chosen? So the reason being is we have to think about her diagnoses. So if we look at her history, she has a history of osteoarthritis. So for osteoarthritis, the crepitus and bilateral knee joints and enlarged bony nodes on hands are signs of osteoarthritis. So we know she has that. So for her, that is normal. Abnormal for anyone who doesn't have that, but for her, normal. So that is why that is not an answer. And then if you look at her white blood count of 12,000, that is also abnormal for someone who doesn't have chronic lymphocytic leukemia, because she has that, for her it is normal. So those 3 in red are abnormal findings in a normal person without those disorders, but you have to kind of keep in mind what are her diagnoses and how do the findings correlate with that. And then everything in blue are our normal findings. Those look pretty good. Blood looks fine, and then her following commands there. And then the yellow is what's actually abnormal. So what I would recommend you guys do, and I know you will likely get a question like this on your NCLEX, is to first select all abnormal assessment findings. So look at your assessments, select all the abnormal assessment findings, then go through and select all abnormal lab and vital findings. You can do this simultaneously too if you want, but go through each one. Is it normal or is it abnormal? Then rule out findings that, although may be abnormal, are typical for the disease process that they have and not concerning. For example, with the crepitus and the knee joints and things like that, those are abnormal, yes, but they're typical for osteoarthritis, and not concerning at the time. So those are not answers. So I hope that'll help you guys with answering that question. Alright, let's go to the next one. So here we'll just kind of go through. So acute pulmonary edema. Looking through these answers here, which one makes the most sense? So acute pulmonary edema, you have fluid in your lungs. You want to get that fluid out of your lungs. So administering furosemide, which is a loop diuretic and helps to excrete water, will be your best nursing intervention for that. For fatigue, consulting cardiac rehab is the best answer. You could also say, repositioning to help them be more comfortable, but consulting, especially when she's here for a cardiac issue, cardiac rehab is a good option. Hypokalemia, we want to administer potassium supplements. That one's pretty straightforward. If they have as long as you know hypokalemia is low potassium, administering potassium supplements to treat that is perfect. Cardiac dysrhythmias. So the best answer again for this is to monitor cardiac monitoring, EKG. Monitor oxygen saturation anytime the heart is in demand, is hypoxic. It can cause arrhythmias. And then serum electrolytes can also cause dysrhythmias. Last one, hypoxia. If they're low in oxygen, we can replace or give that oxygen therapy, administer oxygen. So I think this one's pretty straightforward. Alrighty, so the third question, the provider has prescribed furosemide IV. What pharmacy class is furosemide? So furosemide's a loop diuretic. Alright, next question. Which of the following discharge instructions will the nurse provide the client and her daughter? So select all that apply. So the answers are to weigh yourself each day at the same time on the same scale to monitor for fluid retention. Typically in heart failure patients, if they gain 1 pound to 2 pounds in a day or greater than 3 pounds in a week, you would want to see your provider and see why you're retaining fluid. Fluid on a heart that has trouble pumping is never good. It just puts more stress on the heart and the body. Contact your healthcare provider if you experience cold symptoms. Cold symptoms can be like a start of a exacerbation in patients with heart failure, so good to notify your healthcare provider. Exertion can cause another episode of heart failure, so help your mother by performing daily activities for her. So although the thing that's incorrect about this is we still want to encourage patients to do what they can do and perform their activities of daily living, just within the reason of any discomfort they feel or like exertion. Notify your healthcare provider if you experience shortness of breath or chest pain while resting. Yes. And then do not use table salt, avoid salty foods, and read labels on food items to ensure your diet is low in sodium. That is correct as well, and that'll help also reduce fluid retention. Alrighty, thank you guys so much for watching. I hope you learned something. I think these are really exciting. They will help you learn how to take the next generation NCLEX and really practice your critical thinking skills. I'll be posting more case studies NCLEX, so hit that subscribe if you would like to be notified of more, and I'd really appreciate it if you'd also hit the like button. And thank you so much for watching. Have a good day, you guys, and